Okay. All right. So this presentation is called Cognitive Health. I think, therefore I am healthy. Starting off, just kind of defining cognition, it really is the mental process of how we take information, input, how we store it, how we use it to then guide both behavior and just making sense of the world. So we can think about attention, we can think about kind of executive function, which are kind of those planning, decision-making kinds of things. Also, the ability to be flexible in the way we approach things. Memory is a huge part of cognition. Planning, reaction time. Social cognition is probably one that people maybe have the least experience with or exposure to, and that really is talking about how we interpret how others present themselves, and then how we then react to that. So you may have seen cognition broken into domains. So we talk about kind of processing speed. So how fast the brain takes in information and processes that information. Attention, not only in focused and sustained attention, but also selective attention. So there's this thing about sensory gating where we can kind of pay attention to things we need to pay attention to and kind of filter out the distractions, things that are going on. Memory and learning, so short-term, long-term memory, the ability to learn based on memory, and those executive function pieces. So really how we direct and divide our attention, that planning process, starting tasks, monitoring how things are going, decision-making, things like that. When we look at some of these domains and we look at how that might present for people who have different of the mental health conditions that we work with, you can see that across schizophrenia, bipolar disorder, major depression disorder, there's different degrees. And this is, again, on average. It's very individual. Different people can have very different cognitive experiences. But this kind of gives you a sense of where some of these things might be some challenges for people. So focusing in on memory, this is a task that people are probably pretty familiar with. I'm going to give you 3 words. Don't write them down. I want you to remember them. So those 3 words are red, elephant, happy. So go ahead and repeat that out loud. Red, elephant, happy. And I'm going to ask you about that later. So when we think about using cognition, we need to think about all the different steps that are involved in some pretty basic tasks. So a pretty basic task that probably a lot of us do or have other people that we hope do is making a doctor's appointment. So let's think about all the different steps that are involved and how that affects the different domains of cognition we're talking about. So you need to pay attention to the scheduler, understand what's being said or written down. Think about what other appointments or obligations you might have planned during that time so you can avoid a schedule conflict. Remembering to write it down and then remembering to look at where you wrote it down on the designated day. You also have to plan how you're going to get there. Organize yourself, make sure you're there on time. You may need to take notes on what you want to discuss during the appointment. And this doesn't even take into account, okay, maybe there's a web portal that you have to schedule your appointment through as opposed to with a person, things like that. So there's a lot of different steps and a lot of different pieces of cognition, and depending where your skills or maybe some challenges might exist, even the supposed simple task of scheduling an appointment might still create some challenging issues for you. So there's a lot with memory and planning and organization, comprehending, even knowing language and recognizing different pieces. When we talk about cognitive health, it's really that the brain can perform these tasks in a healthy way. So we're able to pay attention to things, we can learn new things, we can use intuition and problem solving, memory, planning, goal setting. Someone said to have good cognitive health if they're able to focus for stretches of time, recall people's names, scheduling things, keeping in your head, maybe cooking a new meal, being able to follow those steps, thinking and speaking coherently, and just basic using common sense. Whereas the opposite, when people are having challenges with cognitive health, really we see those challenges with focus. I can say having difficulty recalling names at times, maybe missing appointments, again, judgment issues, thinking, and things like that. Some known risk factors that we see in the literature have to do with age, family history, education, brain injury. So definitely any kind of closed head or open head kind of injuries, exposure to pesticides and toxins. We see, for example, when people are exposed to lead at an early age, a lot of cognitive challenges. Physical inactivity and even the side effect of certain medications can be risk factors for developing cognitive issues. In addition, there's some contributing factors, so heart disease, stroke, diabetes, Parkinson's, substance use, even caffeine, people that use coffee as well as alcohol and other substances, and mental illnesses. So we definitely see some cognitive symptoms associated with schizophrenia, major depressive disorder, bipolar disorder, variety of anxiety disorders, and also what we eat, staying hydrated, sleep has a significant impact on our cognition, that lack of physical activity, lack of mental stimulation. So when we think about individuals who experience psychosis, we see these cognitive challenges before we actually see that start of psychotic symptoms. It goes across multiple domains, so you can see social functioning, work, independent living, things like that, and actually persists into remission. So even when some of the positive symptoms and even the negative symptoms may be controlled, we still see the cognitive symptoms persisting. And actually, the challenges with cognition really does predict some of the functional challenges that we see people experiencing. So this group hopefully is familiar with this notion of duration of untreated psychosis. When we're talking about first episode psychosis, we talk about the time between the onset of those psychotic symptoms to when someone actually starts treatment. That can be anywhere from weeks, days, months, years for some people. And the association between that duration of untreated psychosis and when they actually start getting treatment can have some association with outcomes short-term and long-term. When we look at kind of the course of schizophrenia and we look at from that first episode, from the onset of those fluid psychotic symptoms on into the stable phases, if you will, that's where we see still negative symptoms and the duration of those cognitive symptoms and social functional issues. If we look to the left side of the onset of those psychotic symptoms, though, we can see in, these are kind of older terms, but that premorbid and prodrome phases where we see a lot of cognitive challenges, social challenges, functional challenges. So there's this notion that cognitive impairment and functional decline are actually starting before we see the onset of those psychosis. And Dr. Chris Bowie talks about DUP, also what he refers to as DUCI and DUFI. So the duration of untreated cognitive impairment, duration of untreated functional impairment can really have an impact again on people's outcomes and how things might go for them. So this was just a study that was looking at individuals at that first episode of psychosis compared to healthy controls. And we can see that compared to those controls at that 50th percentile, people who experience that first episode of psychosis have significant challenges in memory and those executive functions, processing speed, things like that. Not so much in kind of what is associated with intelligence. So cognition is not necessarily intellectual ability. So this was a really good quote because it was from an individual saying, it's like my brain is stuck in mud. Can't think fast enough, can't make decisions, can't follow conversations. Everyone else at work seems to like change, but I lose sleep over it. If we look at kind of the flow then, so if I'm having some cognitive difficulties, tasks will seem harder to me. If tasks seem harder, I'm likely to disengage. If I disengage, I'm probably going to even have less confidence that I can do the things that I need to be doing, which will then lead to withdrawing from tasks, maybe decreased functioning. I'll be cognitively understimulated in my daily life. And it really becomes this vicious cycle for people. So what can we do about it? There's a lot we can do about it. The main things is we want to assess and intervene as early as possible. We want to really look at just some overall health approaches that are known to help with cognition, as well as adaptive approaches and cognitive remediation. So thinking about cognition, we want to make sure that we're assessing all those cognitive domains as early as possible and across the spectrum. So even as people are starting to get control of positive and even negative symptoms, let's really pay attention to what are some of the other cognitive symptoms people are challenged with. Really work with them to identify their strengths, needs, challenges, preferences, and identify opportunities that we can really help people. So when we think about this, we don't want to mistake cognitive issues for behavioral problems. So when we see people that can't concentrate, can't focus, they can't remember things, if they become disengaged in those activities, it's not because they're being behavioral or being obstinate. It's really those cognitive challenges that are having some issues for people. So just general health approaches really do help cognitive health. Exercise, physical activity has a lot of very positive associations with cognitive ability. Healthy diet, if people have some nutritional issues that can really also affect their brain health. Sleep is another area where if we can help people improve their sleep, we can really improve their cognition. Think if you're really tired and you try to drive, how challenging that is to even just pay attention to all the things you need to pay attention to. Mental stimulation, a lot of times people might get isolated or pulled back. And so if people can stay mentally stimulated as well as socially stimulated, we absolutely can see that cognition can get better. And stress has a significant issue. So if we can help people manage their stress, we can definitely help improve their cognitive health. There's also cognitive adaptive approaches. So if we think about those categories of cognition, we think about memory, we think about problem solving, we think about ability to kind of interact with others and kind of perceive what's going on. So even things like setting up reminders. If someone has a challenge with taking their medication, remembering to take their medication, associating that with something that they already have as a habit. So let's say they take their medication in the morning and before they go to bed, they brush their teeth in the morning and when they go to bed. They put their pill boxes or bottles next to their toothbrush or toothpaste. That might be a way to kind of help them adapt the environment to also then help with some of the things that they're challenged with. There's a lot of tools. I've seen people as low tech as Post-it notes all over the place, and people as high tech as, setting up reminders in their phones, using apps, things like that. Preparing for challenges. So one of the cognitive issues people will experience is that ability to kind of plan and problem solve, especially in the moment. And so the more we can help people think about potential challenges and how you might address those, what are different ways, coming up with multiple ways, then they can kind of have it easier to be able to switch in. And even just thinking about accommodations at school or work. So if you're an individual that has difficulty really keeping your attention and keeping your focus, there's too many other distractions. It may be a simple accommodation of being able to do your work in an area that isn't quite so overstimulating. It might be the ability to wear headphones. So there's a lot of different things that we can do to really help people be successful. And then we have cognitive remediation. So cognitive remediation, there's several different models. The Beth Center supports action-based cognitive remediation as well as cognitive enhancement therapy. And this is really kind of learning skills, really improving a lot of those critical aspects of cognition that can help people be more successful. So when we think about cognitive remediation, the models really have elements of teaching, didactic, concrete information, cognitive training in the form of computer exercises and games, strategy monitoring. So identifying what did I do to do that? And then how can I do that again? Or what might be some different strategies I could try? And then really testing it out in the real world. So how can we bridge whatever skills we practice in cognitive remediation into our day-to-day lives? And so the goals, we really want to just focus on process and strategies. So figuring out and having multiple options, really be flexible in our thinking. So understanding that there's more than one way to approach things, and really be able to experiment in that safe environment so that when we do get into some more challenging situations, we have that experience under our belt. One of the critical pieces is really helping people change that perspective. Instead of failure, I did bad, to this was a challenge. So with a challenge, it's not that I can't do it, it's the approach didn't work. So if I try a different approach, I may be able to be successful. So I want people to put in the chat, what were those 3 words I asked you to remember? We've got some very talented people in the memory department. So it was red, elephant, happy. And I also put another cognitive challenge to you where the pictures didn't match the words. And that's another piece, is how people learn verbal versus visual, those things. So I'm very proud of everybody here. So again, cognitive health is the goal, regardless of whatever else people might be challenged with. Recognizing those strengths as well as challenges, really shared decision-making, and identifying what are the best approaches for an individual, and really keeping that whole person approach in focus. And so with that, I will stop and see if there's any questions.